Hi, I'm Dr. Vibha Gulati and I'm a practicing dental surgeon with specializations in aesthetic dentistry from Manipal and implantology from Frankfurt University. Today, I would like to brief you about the importance of maintaining oral hygiene and what are the methods by which we can achieve it. Maintaining a good oral hygiene is of utmost importance and it has many benefits. To mention a few, firstly, to be able to chew properly and consume the right diet and nutrition which is needed for the overall well being. Secondly, to be able to speak with clarity. Thirdly, to show a confident smile, which in turn greatly affects our personality. And lastly, to be free of gum disease and tooth decay. So let us begin by understanding why is it so important to maintain our oral hygiene. Are you aware that our mouth has millions of bacteria, both good and bad? And if we don't maintain our oral hygiene, the harmful bacteria tend to multiply and thrive and cause cavities, which is tooth decay, and even gum diseases. Tooth decay is a result of localized destruction of tooth structure, and there are many factors which contribute to it, which are plaque, sugary food and diet, dry mouth, and poor oral hygiene. When I say plaque, I mean it is the white, sticky substance which gets layered onto the tooth structure and it contains millions of bacteria. Also, bacteria from our mouth can travel to other parts of body and affect it. For example, a patient with a prosthetic heart valve, the bacteria from the mouth can travel via the bloodstream and cause bacterial infective endocarditis. Similarly, in a patient with diabetes, if a patient has uncontrolled diabetes, that patient can be more prone to developing gum disease. And on the other hand, in case the patient has an acute gum disease, it can lead to increase in the blood sugar levels of that patient. Diabetes can also lead to dry mouth and other dental related issues. Therefore, by maintaining good oral hygiene, these risks get minimized. Now that we understand the importance of maintaining good oral hygiene, let me tell you the ways by which we can achieve it. First and foremost, by good brushing. We all know we should brush twice daily, and night brushing is very important. The toothbrushes available are in soft, medium, and hard. They may be manual, battery operated, or electric. It does not matter which brush you use, be it a manual or an electric one, but your brushing technique is very important. But we also recommend using a soft bristles toothbrush, always. We should always brush for 2 minutes minimum. A minute for the upper teeth and a minute for the lower teeth. And always use just a pea-sized quantity of your toothpaste over your toothbrush. We have natural spaces between our teeth, and food and plaque tend to get accumulated in these spaces, and sometimes even after brushing, we are not able to clean them completely. So, for cleaning these areas, we should use either a dental floss or an interdental brush. In areas of tight contact between teeth, flossing is recommended, and wherever you have gaps or spaces between teeth, you should use interdental brushes. Never use toothpicks. They are very damaging to the gums. Next is mouthwashes. Mouthwash can also be used to maintain good oral hygiene. There are many options available in the market, so ask your dentist which is best recommended for you. When you use a mouthwash, spit it out and do not rinse with water. Also, do not swallow the mouthwash. And avoid to eat or drink anything for at least a minimum of half an hour after using a mouthwash. Another electronic gadget that can be used is a water pick system. It uses a water jet to wash out any food and debris that remains on the teeth and gums. It is highly recommended for patients who have implants in their mouth, artificial teeth, any prosthesis, or even patients having orthodontic braces, because it really helps them in maintaining very good oral hygiene. Next, I would like to talk about diet and habits and their significance in our oral hygiene. Snacking between meals can cause cavities. Consuming sugary food and drinks like soft drinks, fizzy drinks, energy drinks, and energy bars, even juices, can also cause cavities and should be avoided. Smoking is also harmful. It causes staining, gum diseases, and even delays healing if we undergo any surgical procedure in the mouth. Alcohol is also detrimental as it's acidic. It causes the wearing of our teeth. Therefore, all of these, sugary food and drinks, snacking in the middle, alcohol, and smoking in excess should be always avoided if we want to maintain healthy teeth and gums. I would like to give you a demonstration of brushing. With your teeth a little apart, always hold the brush at 45-degree angle. The bristles should be engaging the gum line. Circular strokes, moving down and up, and keep moving forward. Likewise, brush all the outer surfaces of teeth. Next, the biting surface needs to be cleaned. And most importantly, don't forget to clean the inner side. Again, engaging at a 45-degree angle and scooping outward to remove any debris and plaque. In case you're using an electric toothbrush, then the technique remains the same. It's just the effort is a little lesser here. Engage the bristles 45-degree angle, involving the gum line, and keep moving it. Likewise, the biting surface and also involving the gums, the inner surfaces of teeth. Always remember to clean your tongue after brushing. In some toothbrushes, we have a tongue cleaner included. Otherwise, you could use a tongue cleaner separately. Outward stroke, just clean the tongue after you brush. Always use a pea-sized quantity of toothpaste over your toothbrush while brushing. Let me give you a demonstration of how to floss your teeth and use an interdental brush. You could use a string of floss where you could tie it around your index finger. And use it to gently slide in and out between your teeth to clean the areas between the teeth. Flossets are also available in the market and they're easier to use. Just slide it in and out, cleaning between teeth. For areas where you've got bigger gaps, you can use an interdental brush. Slide it in and out. It should all go perpendicular into the spaces and come out. Never enter like this, you would injure your gums. And if in case there's a tight contact, do not force the brush to go in. Rather, use a floss in that area. I would like to conclude by saying, always brush twice a day. Use a fluoridated toothpaste always for brushing. Visit your dentist every 6 months for a regular checkup. Always get professional cleaning or scaling done by your dentist every 6 to 8 months. In case your dentist notices any cavities in your mouth and suggests restorations, please get them done at the earliest, because These cavities tend to spread to adjacent teeth and opposite teeth, and later on you would have to get multiple restorations. Thank you and keep smiling.